Mr. Speaker, my question is for the Minister of Addictions and Mental Health. This is a government that ran on a promise of universal mental health care, but Nova Scotians are still waiting. Instead, we're seeing a patchwork of pilot projects and private companies in place of a truly universal system. The new single-session program offered through for-profit TELUS Health is no replacement for this, and many have expressed concern about the program, especially in lieu of other accessible mental health care. The Nova Scotia College of Social Workers noted recently that the majority of people who need free mental health care have complex needs that require more than one session, and I'll table that. When will Nova Scotians see a truly universal mental health care program, as promised by this government?
The Honourable Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. I thank the member for the question. So we've had historic increases in the budget this year for addictions and mental health care. The Access Wellness Service specifically is another new first-of-its-kind service in the province, along with mental health acute day hospitals. A number of significant pilots in the budget, which I'm sure I'll have the opportunity to discuss at estimates today, so I'm looking forward to discussing those. So we continue to make significant investments, Mr. Speaker, and we will keep that promise. Thank you.
The Honourable Member for Halifax Citadel Sable Island.
Mr. Speaker, while extending any kind of mental health support is a welcome task, many have called into question this government's decision to outsource this program to a for-profit company like TELUS Health in a 5-year contract totaling $11.5 million. NSGEU, who include many unionized therapists and counsellors, have filed a grievance with the province about this decision, stating that the government is handing their work to a private company rather than growing capacity in the public sector. It's a slippery slope once you start there, and I've tabled that. Why does this government insist on funneling money to private companies over making good on their promise to provide universal mental health care?
The Honourable Minister for Mental Health and Addictions.
Thank you, Mr. Speaker. Speaking from the perspective of a frontline mental health clinician, I certainly value the work that they do in the public system. We've been very clear since we formed government and since I was in this position that we will leverage partnerships with the private sector. These are free services available to all Nova Scotians by Nova Scotian clinicians who do a great job. Thank you, Mr. Speaker.